thank you so much for the program this morning on ITV. Talking about the COVID-19 cases in the country and talking about the vaccination as well. Well, we are still expecting the vaccination in those states, and good ones know that major states in the country are ready for the vaccination exercise. Just like what we always do here, we always like you to know the daily updates of the COVID-19 situation in the country so that it will kind of give you some form of encouragement so as to continue to observe the non-pharmaceutical procedures so that you can fight COVID-19. Well, as at today, being the 10th day of March 2021, we have the report that tested samples so far in the country stands at 1,601,396, and of course out of that we have confirmed cases that stands at 159,252. For active cases in the country, we have 18,208, and for discharge cases we have 139,056. For deaths we have 1,998. Now, if you go down the NCDC daily report, you have various states as they appear in tabular form. It's a good one to know that we are not resting in our oars, but what seems to be very, very disturbing now is the community transmission that we seem to be experiencing in the COVID-19. Against the backdrop that the vaccination exercise is going to start in major states any moment from now. But worrisome enough is the community transmission. I was watching a piece a while ago whereby the NCDC incident manager for the state, Dr. Obi, was kind of saying that yes, there is evidently community transmission, and what seems to be responsible for that is the way and the manner people are still going about the non-observance now of the non-pharmaceutical procedures. Now, what are these non-pharmaceutical procedures? Wash your hands regularly, and of course always go with your face mask, and always sanitize your hands. Avoid crowded environments. And very, very disturbing to know that a lot of people are not observing all this. You need to know that COVID-19 is real. It is real. It is not a fake news. It is real. The more you believe in it, it is better for you so that you can fight COVID-19. Well, for Edo State, as of yesterday, we have a report that 56 cases were recorded and 2 deaths. It's not true. It's a good one that we are fighting. The government is not resting, doing measures, putting measures in place to wrestle COVID-19. But we need to support the government of Edo State so that we can actually have the figures reducing and until we have a zero figure in the state. Well, to look at the different phases of the vaccination exercise that the Federal Ministry of Health made us to understand when Nigeria received the COVID-19 vaccines. We are so privileged to have Dr. Leonard Atikidi. Is a family physician and a consultant with the University of Benin Teaching Hospital here in Edo State. So you're welcome to this program this morning.
It's a pleasure.
And subsequently, we should be able to have more health practitioners, most especially the coaching officers in Edo State, so that we can talk more on the preparation so far as it relates to preserving the COVID-19 vaccines. When Edo State eventually receives the vaccines, and we'll just let you know all that. So you're welcome one more time.
It's a pleasure.
Now, community transmission, that's where we are now, and it's very, very disturbing. What do you think is the major responsible factor for the community transmission of the COVID-19 as it stands now?
Yeah. Again, good morning, viewers at home. From what we have seen since this disease came into existence, we still see, even at this stage, that many people don't still believe that the disease exists, even among elites. And again, some people are politicizing the issue. So in some states, some say it doesn't exist. And as a result of that, people are getting confused whether it exists or not. And so they tend to go about their usual activities the way they have always done. For example, you go to parties, the physical distance is not observed. People don't wear face masks. People don't even obey the common hand washing hygiene we talked about. You hardly find people with sanitizers. And so they mix up anyhow. And of course, when you don't observe the NCDC protocol, you are likely going to promote transmission. And in our communities, in our rural areas, you discover that burials still go on the usual way. Birthday parties and what have you, they go on the usual way. They hold their meetings the usual way. You go to markets, place is crowded, nobody is wearing a mask. What do you expect? So we're bound to have the rate of transmission we're having at the community level. And of course, that is not too good for us, because it's likely going to also increase mortality rate that we'll experience from this disease, especially among our elderly that usually are the ones you find in these rural places. So community transmission is a problem, and I don't know, it's quite difficult for us to convince our people that this disease exists, but we will not give up. We'll continue to propagate the message so that people will know that yes, it does exist. So that is where we are currently.
Okay. Now, the vaccination is yet to start in almost all the states in the country. Edo State is yet to start its vaccination. Now, we have the reports of community transmission. Now, what does this portend for the intending vaccination?
Well, where community transmission on its own has some form of advantage, in the sense that, yes, in the sense that until more people have it, we are not going to attain the herd immunity we talk about. And once we have this herd immunity, of course, it's going to also help us somehow. We are not encouraging that we should spread it, because there's always going to be a fallout of that. Some people must die. Are you getting me? But with this community transmission, that also means that we need to also speed up vaccination. Because if we don't, we are likely going to have many more persons dying as a result of the disease before they ever get vaccinated. So we need to speed up our vaccination effort so that we don't end up killing especially our elderly ones and those with more premorbid conditions. So that is the issue. So vaccination, we need it faster than it is going right now. Otherwise, we are likely going to lose more persons at the community level. Despite this, it will also somehow have, assist us to achieve herd immunity that, of course, will help us to bring the disease relatively under control.
That's the point that I don't quite understand. Healthy immunity. I mean, when we say community transmission, we're simply saying that it spreads in a very high rate. So when it spreads that way, what kind of relationship it has with
You see, now, like this disease is still evolving. Yes. If you have had the disease, we expect you to have some level of protection against the disease itself.
Okay, that's how it is?
Yes.
If you have contracted the disease?
Yes, it doesn't mean you cannot contract it again, but there is the likelihood that you have more or better resistance to the disease if peradventure you are faced with it a second time. But all of these are all still undergoing what do I call it now, scientific investigations or what have you. Yes.
Okay. Now, at the receipts of the vaccines that came into Nigeria last week, the Honorable Minister of Health, Dr. Ihanire, said that the vaccination exercise is going to go in phases. He said phase 1, phase 2, phase 3, phase 4. The phase 1 has to do with the frontline health workers, while phase 2, has to do with population between 45 and 65. Then even those that have morbidity. Now, what is morbidity?
Now, when we talk about pre-morbid conditions, what he's saying in essence is that, for example, those who are sick, probably they are hypertensive, they are diabetic, or they are asthmatic, because when they contract the disease, it's likely going to get worse with them. Or persons who are even obese, who have respiratory issues. So when they contract the disease, it's likely going to get worse. So you need to protect such persons earlier than those who will not go down with the disease easily when they contract it. So you look at the pre-morbid conditions of this population and try to do something to protect them. And that is why they are categorizing the whole vaccination into phases. So like you talk about frontline health workers, those who are in isolation centers, doctors who are the gatekeepers at various hospitals, nurses, all other health workers. Because these are people who come across undifferentiated patients. When I say undifferentiated, the patient comes in, you don't know what disease the patient has until probably you have, cleared this patient, you then and make a provisional diagnosis. If you suspect COVID, before you go to screen. So, but before this time, you attend to this patient like every other patient. For example, some doctors have contracted disease. Why in theater? Why trying to save the life of another Nigerian who is at the point of death? Because at that stage, even if the patient is suspected to have the disease, you just have to do something to save that life. You cannot just say because the patient, is suspected to have COVID, you just abandon the patient and let the patient die. No. So, and because of that, frontline workers, doctors, nurses, and others need to be protected first because they are faced with this disease. So, and I think the various phases is proper because there's no way the government can afford. In fact, the vaccine will not be available for 200 million Nigerians at once.
Yeah, the phases ranges from phase 1 to 4. The last set of people are those from 18 years till about 40. They fall in the category of the last phase. That's phase 4. Now, when we received the COVID-19 vaccine, we received about 3.94 million doses of the AstraZeneca COVID-19 vaccine. For some people, they are of the opinion that this won't go. If you take all these phase 1, phase 2, phase 3, phase 4, it won't go anywhere. What's your take on that?
There are several factors that government has to put in place. Let me tell you, even now that they are using this vaccine, right now it's at the phase 4 clinical trials. That means as you are giving, you are still studying to know the effect of this vaccine. Is it really effective?
You mean the makers of AstraZeneca?
All the vaccines, all. Not just AstraZeneca, all of them. Are
you speaking authoritatively on that?
Yes. See, for every drug, there are different phases of clinical trial, and there are 5 phases. Though the first phase, the preclinical trials, is not classified as a phase as short. There are 4 recognized phases. In the last phase, what you do is that as you continue to administer this drug, you still have to take statistics of effect of this drug on the on a larger population. Are they responding to the disease? Are they reacting to this disease? The reaction to this vaccine, is it more deleterious than the disease itself? That is why you see sometimes they bring some drugs. They bring out some drugs, and at the end of the day, they withdraw them. You know, for example, there's a drug we used to call thalidomide. It was used for treatment of.
No, we can't mention names of drugs on this.
Okay.
Okay.
No, it's a drug that is known all over the world that was withdrawn. It's no longer in use.
Okay, all right.
Yes. So at the time it was being used, they were still studying it, and at the end of the day, they discovered that it was causing acromegalia and what have you. That means children without limbs and what have you. And eventually it was withdrawn. So even when the vaccine has been released for use, they will still study it over many years to see the effect of this vaccine. Is it really working? Is it doing what they say it does? What is the effect on the people? So right now, even with the use of this, and if you also look at it with the speed at which this vaccine was produced, ideally production of vaccines and drugs takes years, but this was done within a few months.
Within a year?
Yes.
Yeah.
So you see, there is still need for us to continue to study this vaccine to know the effect of this vaccine on the population. So for me, I think it's reasonable for government to choose to give this vaccine in phases. Supposing you choose to give the vaccine to everybody at once, and it is deleterious like thalidomide, what do we have?
Anyway, Nigeria is not the first country that is taking the AstraZeneca. India has been taking it, and there are no records of adverse effects, detrimental to the population there.
I get you. Wait.
That's Ghana.
Wait. Let me tell you. When we talk about populations, the genetic makeup of certain populations differ. That is why you have to try it on different populations. And again, when we talk about population, you also talk about different age groups or different age grades. So even if they've been using it somewhere else and they've not found any serious adverse effect, it doesn't automatically mean that they will not try it on other populations. So they will still try it and see what is the effect.
Anyway, let's, you are a health worker in Edo State here and in Benin City, and you may be very conversant with what the Edo State government is doing with preparation for the inoculation and maybe for the COVID-19 in total. Now, what's your take on the preparation? You may have seen one or two things that the state government is putting in place to make sure that when Edo State starts vaccinating people, it will be a smooth ride. What's your take?
I think government is making effort at all levels, and Edo State inclusive. And the effort they are making, I think if they continue at that pedestal, I think we are going to have good results. In the sense that I know currently that people are going around educating others about the vaccine, because there are so many myths and stories about the vaccine, and we are trying to disabuse the mind of the people from those things that, there are some videos they are circulating here and there that they gave somebody, the person had rigor and eventually slumped and died. So government is making effort to disabuse the minds of the people from some of these stories and myths that are not really correct. So, and I think they need to build on that. They need to get to our communities. Our health workers need to get more involved. Our associations need to get more involved. Market women need to get more involved, so that we will get the story down to our people, so that when eventually the vaccine is available, all of us will go for it.
Okay. Now, one thing about vaccines is that a lot of people really don't understand that vaccines are really not curative. They are rather preventive.
Yeah.
And it becomes more challenging with the COVID-19 situation. Because the way it started, we started with the very scary news that COVID-19 kills and all that. And of course, the world began to look for ways to find a cure. Now that we have the COVID-19 vaccines, different vaccines that we have for the COVID-19. Now, how do we begin to interface, most especially with the people that look, this thing is still not curative, though it's something you need to take for COVID-19. It's still not curative, but rather it's preventive. I mean, as a headline, as a health practitioner, how do we begin to interface that with the people so that it will further create more confidence in what government is doing for the people, in what ways government is trying to help the people to be safe?
We need to let our people know that COVID-19 vaccine is not the first. There are several others that, we have had over the years. Like we know, if we talk about measles vaccine, it's not entirely different from the vaccine we are talking about. Measles vaccine is not curative, but it has prevented us from having measles over the years. Just the same way, the COVID-19 vaccine is not curative. It is to prevent us from having the disease. So we need to drive home this point. Let our people know that this is not the first vaccine we have ever had. There are numerous vaccines that we have had. So for those that were born in the 60s or prior to that time, we all know that before then, a woman can have 10 children and only 2 will survive. As a result, some of these deadly diseases that we now have immunization against. So now, the same way like this new disease that just came, COVID-19, what government intends to achieve is also to ensure that nobody dies again from COVID-19. And the only way we can achieve that is for us to be vaccinated. If you are not vaccinated, of course, you are likely going to, if you contract it, you may die from the disease. Look at polio vaccine. In the past, we have had people that had paralysis from childhood. But with the polio vaccine, I think Nigeria has been classified as one of those nations that are polio free. Mm-hmm. So with the polio vaccine, we were able to eliminate polio from our midst. And so when you have your baby, you take the child for immunization, at the end of the day, you discover that your child is free. Just the same way, the same thing we are trying to achieve with the COVID-19 vaccine. So, and our people should understand that it is not entirely a new process.
Okay. All right, viewers, the program is still this morning on ITV, and we are looking at phases of the COVID-19 vaccination exercise. In Nigeria, we have the vaccine here. We have the AstraZeneca vaccine, and states are yet to, Edo State is yet to have the vaccine as we talk about the vaccination. Now, the one question that people ask is, how many doses, what is the complete dose, of this AstraZeneca? Some say you have to take it, you have to take like 2 jabs, that's 2 containers and all that. Why some say that you have to take it thrice. From your own experience with the AstraZeneca, what is the complete dose of the vaccination for AstraZeneca?
What I know for now is 2 doses.
That's 2 jabs?
Yes.
Okay.
Now, there are some other, you see, in the process of trying to get a vaccine for COVID-19, there are over 170 vaccine trials here and there. There are some that are, they say it's just 1 jab. Like I keep saying, the whole of this process is still undergoing studies. They may come up later to say you need a 3rd jab. When we started even the TT, tetanus toxoid, for pregnant women, in some places at every pregnancy they were giving 2 jabs. A time now came, we now said, no, in a woman's lifetime, all he needs is just 5 jabs. So, and we now agree that for every pregnancy, you just give a jab instead of the 2 jabs they were giving before. So, and that is why I keep saying that even when we have started using the vaccine or the drug, studies are still ongoing to begin to look at the effect of this drug and whether there are new things that are happening as it pertains to that particular drug. So currently 2 jabs.
Okay. Now, as a health practitioner from your own experience, do you think the number of doses you take for the COVID-19 vaccine, is it age specific? Take, for example, Evans Unohuge is 19 years old. I'm young and very virile. Don't you think I may just need 1 jab? I mean, my immunity is still very strong compared to Mr. John that is probably 70 years old.
No, it's not age dependent.
Okay.
It's not age dependent. It's still the same dose for all, So, because they look at the way the vaccine works. A vaccine actually is just a molecule that looks like what causes the disease. Now, they have studied and discovered that the first dose will be able to raise your immunity to a certain level. So you need a second dose for you to be able to achieve what we tend to achieve with the vaccine. So it's not age dependent. All age groups will take the same dose.
Okay, if your immunity is really not age dependent, why do you think that the Federal Minister of Health, take for example in Nigeria, had to warn that 18 years below should not have anything to do with this vaccination? I mean, one would just think that, okay, 18 years below is still strong, they are viral in their immunity, they are strong, so...
No, if you are talking about immunity on its own, yes, immunity on its own is age dependent, but we're talking about the vaccine. When I say immunity, I'm talking about the general strength of the soldiers, let me use that word, that fight disease in your body. It's not just age dependent, nutrition also affects it. So in this particular case, we are trying to protect against a particular disease. And for you to be protected, remember that this COVID-19, no age group is free. But the thing is this, because of the difference in the immune status of the various age groups, those who are younger, the effect of this disease is less in them.
Because of their immunity.
All things being equal. When I say all things being equal, that you are younger and you are diabetic, you cannot be classified as those that we are talking about that their immunity is better. You are younger and you are asthmatic, you cannot be classified among those who are saying that their immunity is better. So that is why I said all things being equal. So the younger ones, of course, their immunity or their immune status tends to be better than the older ones because the entire system is winning. So immunity on its own is age dependent, the immune system. Now, but for the vaccine, for you to be protected against the virus, you need to take the required dose because this is specific. What I mean, the protection or the immunity you are trying to generate, the antibodies you are trying to generate to fight the disease, it is specific. So, and by specificity, I mean that it is against COVID-19 itself.
Okay. All right. Now, for pregnant women, is it safe for them to take the vaccination? And if they take the vaccination, what happens to the child that they are pregnant with?
Well, like I told you earlier on, the whole of this process is still evolving. For now, I don't know what they do with pregnant women with babies, but I want to assume that if the vaccine is safe for use by humans,
of course the vaccine
yes,
is safe.
I know it's safe.
Yeah.
What I'm saying in essence, that it may depend on the stage of pregnancy.
Okay.
Because most times, in the first trimester, that's the first 3 months of pregnancy, we usually avoid so many drugs. I'm not saying that is what is happening in this case because I don't have the data or the information. But I would think that in the first trimester of pregnancy, that vaccine may not be administered. But, subsequently, it may be given.
Okay. Now, the thing about the phases also, as it relates to states, has to do with the level of preparedness. The Minister of Health, Dr. Saige Hanere, said that upon the level of preparedness for states, the Federal Ministry of Health will have to roll out these vaccines to states and all that. Now, when we talk about the states of preparedness of states, we're talking about the facilities on ground for the reception of the COVID-19. You have praised the state government, the Edo state government, that from what you are saying, it shows that the state government is ready. But let's also talk about the preparedness of those that will receive this vaccine, those that will be inoculated, you and I, that will be inoculated. There's still so much might in the minds of people, that no, I'm not going to take this. A lot of people are actually expecting, even among lecturers too, a lot of people are actually expecting that, okay, let some people take it first, let's watch. So how do we begin to talk, in all this?
Well, what government is currently doing, they try to let people know that it's safe. For example, the first few doses were taken by President, Vice President, and his ministers also. And I also think that is what the states are doing. The governor will take, the deputy will take, and maybe other members of his ESCO. And to the glare for all Nigerians. That is to convince us that, yes, this vaccine is safe. It's not going to kill anybody. Despite that, I see here some people making comments. Are you sure it's really the vaccine they are taking?
That it was not empty syringe.
It's not the placebo they are taking. But that is the nature of humans for you. Even in the Bible days, Thomas doubted until he saw Jesus himself. So what I'm saying in essence is, yes, despite all these minds, all these doubts that we have, we will continue to persuade the people. Say, look, you need to take this vaccine. No, we have had occasions where you are somewhere, somebody tells you this disease does not exist. Until you now come up and you say, you think it doesn't exist? So do you know such a person? They will tell you yes. Such and such a person had it. Can we call him? And the person will actually come and say, I had this disease. This was my experience. Some will believe, some will still tell you that, it was malaria you had. What I'm saying in essence is that COVID-19 is real. And we all need to get set to be protected against the disease. And the only way we can be protected is by taking the vaccine.
Okay. Now, for most people, they talk about the conspiracy theory and all that. Now, these are the set of people that don't believe about the COVID-19. Now, the question we're asking is, by the time you have completed a dose, take for example the AstraZeneca that Nigeria is using, you have taken 2 jabs, completed your dose. Do you still have to be going around with your face mask, observing those?
Absolutely. Absolutely.
Why?
It still boils down to the same thing I have told you earlier on. You see, the fact that you have taken the vaccine, nobody is too sure whether if you dive into COVID itself, whether you not have any effect. And that is why I told you earlier on that in the course of administering a new drug, studies continues until such a time that, yes, we are very confident that this is how this drug works and this is how protective it is. So we still continue to advise people to, abide by the protocol of CDC. Because there are situations where somebody could be a carrier of a disease, but you will not manifest it. You can transfer it to somebody, but yourself, you will not manifest it. Those are some of the things that we need to keep studying to know what exactly happens after you have taken the vaccine to protect you. Does it also stop you from transferring it to others? Are you getting what I'm saying?
Yeah.
For example, that if you take the vaccine and you contact some of those droplets with your hands and you go to shake somebody, you may be protected from contacting the disease. But the person you have just carried those droplets, you have infected the person. That is why you still need to keep washing your hands. You still need to keep wearing your face mask. And you still need to keep social distance.
Okay. Now let's look at the way that the government is trying to employ. The Honorable Minister of Health, Dr. Saige Ehanire, said that on the day of the reception of the AstraZeneca in Abuja, he talked about launching a platform known as TECH, that strategy for COVID-19 vaccination and electronic management of immunization data system. In other words, they are trying to get a data system for those that are going to be vaccinated. For most people, this is not necessary because you are dealing with a population that is very hard to convince. As a matter of fact, a lot of Nigerians are yet to still believe whether it is COVID-19. Then you're also asking them to register in a database and all that. Now, what kind of alternatives do you think government can begin to think of now so that when the vaccination exercise starts, take for example in Edo State, when it starts, that people won't begin to disbelieve governments. They just go straight and take their vaccination and it goes.
You see, it's so important that we must have a database, even in terms of what we are doing now. Because without database, you cannot really go to say, oh, this vaccine we've given to so number of persons, and there was a reaction or not.
But that is rigorous for the population. That's what the population is rigorous. I mean, for them, take for example, a woman in Nigeria that probably has not seen, that does not even know what is that data.
No, wait, you talked about alternative. Yes, in places where you cannot access network or for those who do not have phones, Android phones to do those things, of course, we can also employ the analog data collection.
Okay.
Probably that same form you fill, in the internet, you produce it manually,
okay,
and you give it to people to fill. If you talk about, at least in rural areas, there must be some persons who know how to read and write. And those persons can help them fill those forms. And those officers in charge, they collect them and also enter them into the database. Because it's critical for us to monitor the effect of this vaccine on our people. So that we, at the end of the day, we will now decide, is it really worth it? Is it all the expenses, all the rigors we're going to go to, does it really deserve all this?
Okay. As Edo State awaits the vaccination, what suggestions will you going to be making to the Edo State government so that we can have a good vaccination exercise when it starts eventually?
Yeah, for us to have, first of all, it's not just to have the vaccine, we must also ensure that what we are having is actually potent and it remains potent. And because one of the challenges you may have, like in places like Iura you mentioned, Okpekpe, and several interior villages, Novia, southwest,
northeast,
Nikrowa places, Jakarama and all those places, is problem of transporting these vaccines. Because if there's a particular temperature, they must be, preserved. And outside that, it will denature those vaccines. And once they are denatured, you are just giving something that will not be of any effect to them. And in that wise, if you end up giving what is not potent and you collect data, you are not likely going to have the correct result. So one of the major issues will be the cold chain system, not just in Benin City. We should also ensure that our cold chain system in our local government headquarters are functional. Of course, you can't rely on BEDC, but again, we should talk about alternative power supply. Now, you don't really need BEDC in order for you to be able to preserve some of these things. Alternative power supplies is available everywhere. So what government should do, government should ensure that in all our local government headquarters and probably the wards that we have in the state, we should have an effective cold chain system. Otherwise, we'll be wasting the resources, and again, we may not be giving a potent vaccine to our people. Beyond that, transportation. Because I've heard stories in the past where people are giving the usual routine vaccinations to administer to people. They go under the tree, they enter fake data, they discard them. So in order to avoid all this, we should ensure that people that are trained, health workers who are trained, especially in the administration of this vaccine, they get involved in this process. And government should also monitor and ensure that they do the right thing. And ensure that they are properly remunerated. Because if they may likely engage some ad hoc workers. If you don't properly remunerate them, of course, they go do shady things. So, in my view, government will ensure that the cold chain system is functional, not just at the local government level, but at the world level, so that we'll be able to deliver the vaccine to people in a potent manner.
Okay. All right. Thank you so much, Dr. Leonard Atsikidi, family physician and consultant with the University of Benin Teaching Hospital, talking about different phases of the COVID-19 vaccination, things that we need to know. And he has said that vaccination is healthy, that the AstraZeneca is healthy for vaccination. Now, in due course, we're going to invite, I invited him, as a matter of fact, Mr. Oshwakbeme Gideon, the Edo State coaching officer, but because of very busy schedule, he couldn't make it to this program this morning. So subsequently, we are going to bring him here so that we ask him questions. Let's get to know the condition, the states of this coaching system in Edo State. But again, because we've been inviting these health officers, Dr. Obi has come here to say that the cold chain system in Edo State is ready to receive these vaccines. A very big thank you one more time, Doctor, for coming to the program. The program is still this morning on ITV. We'll take a short pause now so that other segments will come your way. Please stay tuned.